I found out I was not alone. There were a lot of other mothers who had been through similar experiences and were speaking out. Meeting these women was an opportunity to hear about what had happened to their children and come to terms with what had happened to Matthew. Thank you all very much for being here today. I think this is really important things we have to talk about. And I've met so many wonderful people through this ordeal for all the wrong reasons. And one heartbreak after another. So I know there are so many stories just right here in this room. And I want people to know what this can do to families and to children. So thank you for being here today and helping me.
Thank you.
Thank you. You know, they let you think that one doesn't matter. You know, they expect that a certain percentage are going to suffer these side effects, and that's okay with them.
One child's dying.
But it's not okay it's not okay.
No.
And there's one, and there's one, and there's one,
That's
and then
right.
there's 100, and then there's 1,000, and then
That's
there's
right.
10,000,
That's
and
right.
it's not just one.
Yeah.
And
right.
one is too many.
That's right.
But it just goes on and on.
When I took Matthew to the doctor, he was diagnosed with a clinical depression, and they said it was because of a chemical imbalance. What happened to you when you took Candace?
We took Candace because she was exhibiting anxiety at school. She had started blocking on tests, and I had a couple of teachers say, you know, Candace needs to study for these tests, when I would know that she had, because I used to study with her and she'd always make note cards and everything. But she would get to the test and she would freeze, or else her writing was so horrific that she might have had the right answer, but the teacher couldn't read it, so she'd get it wrong anyway. And I took Candace to a highly recommended child psychiatrist, and he talked to her for about 15 minutes and said, well, she has a generalized anxiety disorder. The only way that this anxiety was manifesting itself was in tests. There were no other areas of anxiety.
They're not telling you that it's entirely psychologically based and subjective. They're just saying, oh, well, based on these symptoms, you have a chemical imbalance.
Mm-hmm. And then with a chemical imbalance, it's like, where did they come up with that? What chemicals?
Exactly.
I love that. Like, where's the test? Don't we get a test?
Where are the tests, you know? And
Yeah.
you can draw somebody's blood and see if they have cancer. You can, those are real medical diagnoses. If somebody tells you that your child has ADHD, ask them to draw their blood and show you the chemical imbalance causing this. And they can't do it because they haven't proven the chemical imbalance that's causing this. It's completely arbitrary and subjective, and it is their opinion that that's what's going on with your child, who you are actually the expert on.
They always hide behind, I say they, you know, the psychiatrists and the psychologists, they always hide behind, we're doing this in the best interest of your child, you know? And that's really hard to get around, you know, as a mom. You know, you're out there and you're like, I want to do what's in the best interest of my kid, you know?
Playing on the guilt again.
Yeah.
If you loved your child, you drugged them for their own well-being.
And you want to do what is right for your child, so you bow to the pressure because you think that they know, because they have an educational history, they've gone to college, they're more powerful, they know.
They're the professionals.
You know your child better than anybody. Tune them out. You do what your heart tells you. You don't listen to them.
These women were strong, knowledgeable, and determined to spread the word that what had happened to their children could happen to anyone's. Because when it comes to diagnosing kids with psychiatric disorders, no one really knows what they're doing, as a group of high school students found out when they interviewed psychiatrists at a recent psychiatric convention.
With all the diagnoses out there, how do you know which one to choose?
For a patient?
Yeah.
The diagnosis?
This is a good question.
Well, it can be pretty difficult to pick a diagnosis.
Psychiatry is not like other fields of medicine, and the diagnoses are sometimes kind of muddy.
Yeah, just often pick and mix, so it's not that difficult usually.
I pick the psychosis group of diagnosis.
We don't always make the perfect diagnosis, but we try to make one and revise it.
It's really hard. They're oftentimes wrong half the time.
Sometimes we don't need a diagnosis.
Oftentimes it's not for us as important what the exact diagnosis is.
Diagnosis is based on what is it for. If it's for reimbursement, or if it's to get you off the hook.
You develop a list of possibilities as to what the diagnosis might be.
Well, asking all the questions in your mind. You can't ask all the questions of everybody. You can't ask everybody all the questions. So you have to do the questions in your mind and ask the right questions. And then you pin down. I don't know if that's the right answer.
Whatever your answer is, totally fine.
Matthew's doctor never informed me about the unscientific nature of her diagnosis or the serious possible consequences of taking the psychiatric drugs to treat it. So I went to see the well-known physician and author, Dr. Doris Rapp, to find out what I should have been told. My son was put on the drug Lexapro, and we were told that the side effects were very benign, headache, dry mouth, nausea. What serious side effects should I have been warned of?
Well, drugs such as that can cause depression, it can cause dizziness, and there are many isolated reports of almost any area of the body being affected by those. These are the ones that cause the depression, the suicidal thoughts, the heart disease, the metabolic defects. And I think that obviously lung function and cardiac function need to be monitored on children if they are finding enlarged hearts and the children are having heart attacks and strokes and increased blood pressure and irregular heartbeats. And it was found that many times when you stop these drugs, the symptoms don't disappear. You think the shaking is going to go away. It may not go away. And there's nothing more devastating to a young child than to twitch and have these jerks in their body that they can't control. You should have been told to watch for any change in how your son feels or acts or behaves. Any change in his appetite. Is he dizzy? Does he have problems with his coordination? Right. Did they tell you to contact them if there was any change?
No.
They didn't give you a sheet with side effects?
No.
That you should have received a sheet that said these are the things you might look for. And if you notice any of these, but I think most people would be scared silly because it might be a whole page of side effects and you might not even know the terms, but you get out a dictionary.
Or it's in print that's so small,
that's right.
You can't even
You get a magnifying glass. And I'd say that you shouldn't have to be the doctor, but in today's day and age, with so much going on that shouldn't be happening, I'd say parents, go check on what your children are taking. Don't assume that it's normal to have a reaction if you're seeing one. Call your doctor up and complain. Get a second opinion. But you've got to cover yourself in every way that you can possibly cover yourself. I think you can't drug healthy bodies and make them unhealthy in so many ways and expect those individuals to grow up to be a functional, creative persons in the society. They simply won't be able to reach their full potential because the drugs change them. I think that what is going on is a sin. God must be standing up there saying, what are you doing down there? What are